In previous video, we talked about pelvic tilt and how can create a back pain. In this video, we're going to talk more in detail due to the fact that a lot of my patients, they asking me, how come when you adjust us and we are level in your office, we have to come back for more adjustment. So I'm going to talk more in detail about pelvic and sacrum and why this happens. And I give you a tip so you can prevent to reoccurrence of the pelvic tilt. Now, when your pelvis rotates, we call that pelvic tilt or anterior pelvic. Little anatomy and physiology, so we know what we're talking about here. Ilium and sacrum are base of your spine. The iliac bone and sacrum are connected together with something we call sacroiliac joint. When you come to our office, the very first thing we do, we palpate your bones and we look for your ilium in your body and sacrum, and we put one finger on your center of your sacrum and one finger on your ilium, and we compare the bone whether it moved up or moved down, and that's how we determine if you had some type of pelvic tilt. And then we're gonna palpate your spine. The reason we do that, even your spine will misalign according to your pelvic tilt. Especially your lower back spine or vertebra, they will move and misalign according to your pelvic tilt. And that will cause back pain and, of course, cause many other discomfort all the way to your mid-back and even to your neck. When we're talking about your body, the foundation of your body is your sacroiliac joint or sacrum and ilium. And when they are unstable, as if you don't have a good foundation for your body. Like any other construction, if the foundation is not good, the walls or everything else that depends on that is not going to be stable. If you have a crack in a wall and you have a foundation that is tilted, no matter how much you fix that crack still will reoccur as long as you do not fix the foundation of that construction or what the building. In that building we're talking about today is our body. When people walk in my office, the very first sign I see, if they have a shoulder tilt, either to the right or to the left, I know that's a sign that maybe their pelvis is tilted. And you know, our pelvis and sacrum connected together through the sacroiliac joint and their ligaments. And that's 80% of the stability of that our spine come from these ligaments that are basically sacroiliac joint are constructed. There are 7 or 8 major ligaments that if these are not corrected very well, if they are not stable, they could misalign the pelvis. Basically, when these ligaments, one side is too loose, another side is too tight, we call them unstable. And when that happens, our muscle will take over the job. In other words, the job that ligament should do in a joint, the muscle will do. And a muscle, like everything else, if it keeps contracted and try to stabilize something, after a while it gets tired, and that's why the spasm is created and back pain is being created. Sometimes all the way your lower hamstring and all the way to your calf muscle, they get involved to stabilize your pelvis. And even the muscle tone all the way your back and mid-back all the way to your neck could get affected because unstable ligaments that supposed to be stable on your sacrum that is not stable anymore. And that's why when the ligaments are not very well stable, your muscle will taking over. And if we're talking about ligament as a hardware of your body, the muscle are like your software. the hardware and software, they have to be programmed together. When you come to my office and I adjust you, basically I will fix the hardware. But the software, the muscle, when it doesn't cooperate or is a different tone, and by muscle tone, I will see how spasmatic your muscle and how relaxed your muscle around your spine and pelvis is. Matter of fact, when a patient walks into my office and I touch their muscle and I realize how good or how bad their muscle tone is, I know how long their body is being misaligned. If the muscle tone is really bad, probably their body is out of alignment for a very long time. And I will give them, according to their body, following exercises to do to be more stable when they get adjusted. So every time patient gets adjusted in my office, I give them exercises to do at home. So their muscle tone and their ligament, they all get coordinated together. So you will see the example of the following exercise at the end of this video that I usually give to my patient to do after getting adjustment in my office. Thank you for watching this video. Have a great and healthy day. Please watch the following exercises. If any of them make sense to you, you can do it at home. Have a great